Good morning, Mrs. Chua. Hi. My name is Karen Myers. I'm the PA student who's going to be doing your exam today. Okay, before we get started, I'm just going to wash my hands. Okay. And while I'm washing my hands, I'd be doing a general inspection of Mrs. Chua's body posture, grooming, hygiene, general demeanor, looking for any signs of distress. If I observed her walking to the table, I'd also make note of her posture and mobility as well. Mrs. Chua, I've noted the vital signs the nurse took on your chart of your height, your weight, and your temperature, and they're all within normal limits, okay? So the first thing I'd like to do is take your pulse, okay. Right? Placing my fingers on the radial artery, I would count the pulse for 15 seconds and then multiply times 4. Then while keeping my fingers on the radial artery, I'd observe respirations for 15 seconds and multiply times 4. Good. Okay, now I'm going to take your blood pressure. Okay? All right. Make sure we line up the arrow with your brachial artery. Okay, great. Normally I would do this in both arms, especially if you were a new patient, but for filming purposes today we'll just do the one arm. Next I'm going to just do a general inspection of your skin, looking for any signs of lesions, noting the color, the temperature, the texture, and the turgor. All appear normal and healthy. Okay. Now I'm just going to do a visual inspection of your facial features, noting your hair pattern, configuration of your scalp and skull, any lesions on the face at all. Then looking at cranial nerve 7, I'll have you squeeze your eyes really tight, good, and smile big for me, and put air in your cheeks. Cranial nerve 7's intact. Now, Mrs. Chua, I'm going to test for cranial nerve 5, sensory, so I just want you to indicate when you feel me touch you by saying now, okay? So just close your eyes. When you feel me touch you, say now. Good.
Now, 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 now.
Excellent. You can open your eyes. Now I'm going to palpate the facial bones, okay? And the frontal sinuses, any pressure there?
No.
Okay. And maxillary sinuses, any pressure there?
No.
Okay. We'll palpate the TMJ. Have you open your mouth, move your jaw side to side, and clench your teeth. Cranial nerve 5 motor is intact. Good. And the facial bones are all normal. Okay. Now I'm going to go ahead and palpate your scalp and your skull. Again, noting the texture of the hair, the pattern of hair distribution, and any lesions you may see in the scalp line. And everything looks healthy and normal. Okay, moving on to the eyes, I'll just do a general inspection first, looking at the pupils and the cornea for any signs of icterus or obvious exophthalmos. I'll look into the conjunctiva. It's pink and moist, looks good. Okay, and now we'll do a visual acuity test. Just have you read the smallest line you can, covering one eye. Read the smallest line you can from front to back.
8745 XO 710.
Good. And now covering the other eye, read the lowest line you can backwards.
101400X 836.
Good. And you have 20/20 vision. Very good. Okay. Now, continuing with the eyes, I'm just going to note the depth of the anterior chamber, noting that there are no crescent shadows. Good. And then the corneal light reflection. The direct pupillary reflex. And the concentric pupillary reflex. Okay. Very good. Now I'm going to test extraocular movements. Have you just look at my finger. You're going to follow my finger with your eyes without moving your head, okay? Good. And the EOMs are full bilaterally without nystagmus, and the pupils constrict and accommodate to near vision. Very good. All right, now we'll move on to the ophthalmoscopic exam. All right, just have you look straight ahead. Normally we dim the lights here, but for videotaping purposes we're going to leave them up, okay? So just look straight ahead. I'm going to obtain a red light reflex, and then note that the cup disc ratio is 1 to 2, the AV ratio is 2 to 3, without nicking or spasms. Do the same thing on the other side. And have you look at me, looking at the macula and the fovea, which we do on both sides as well. With Welch-Allen's new Panoptic ophthalmoscope, we're able to obtain a panoramic view of the eye grounds. Actually, the view is 5 times larger than with a standard scope, and we can easily view the fundus in a lighted room or even when your pupil's small and not dilated. Okay? The way you operate the scope is first to focus on a distant object, and then you want to obtain a red retinal reflex in the patient's eye. You're going to move the eye cup into contact with the orbit. That way you achieve the best picture. And you can focus using the focus wheel with your thumb. And you're going to examine all 4 quadrants of the eye grounds. What's really nice too is that you can move to the other eye without changing hands or viewing eyes. Okay, now we're going to check your hearing, okay? I'm going to have you close your eyes, and I just want you to hold up the hand on the side that you hear my fingers, okay? Very good. Okay, you can open your eyes. Now we're going to inspect the ears and palpate the ears for any lesions, lumps, battle signs, ecchymosis, mastoid process tenderness, tracheal tenderness here. Is that okay?
Yeah.
All right, and we'll take a look in the ears. Okay, noting that the canals are patent, the TM is visualized, it's pearly gray and translucent. Landmarks are also visualized. We'll do the same thing on the other side. Tender there?
No.
Here? Nope. Okay, take a look in the ear. Okay. And again, the landmarks are visualized with the cone of light, the umbo, and the malleus, and no signs of fluid in the middle ear. Okay? Next we'll move on to your nose. Okay? I'm just going to occlude one nostril. I want you to breathe in. And now the other side. Good. I'll do a general inspection of the nose, noting no deformities or lesions on the nose. Palpate the nasal bones and the cartilage. Everything appears healthy and normal. And then we'll take a look in the nose. Okay? Noting that the mucosa is pink and moist, and no septal deviation. Terminates are normal. No lesions or polyps. Very good. Now I'm going to inspect the oral cavity. If you can go ahead and open your mouth wide for me. Okay, and I'm looking at the buccal mucosa, and have you say ah. Palate elevates symmetrically. Cranial nerves 9 and 10. Have you lift your tongue up to the roof of your mouth, looking at Wharton's duct and the floor of the mouth. Good. And go ahead and relax your tongue. And we'll look at Stenson's duct on either side. Okay. And any signs of distressed teeth or tenderness there. Good. Now have you stick your tongue straight out at me and move it side to side. And cranial nerve 12 looks great. Okay, now I'm going to get a glove so I can actually palpate the oral cavity. All right, we use a bimanual technique for this so that we can really feel the mucosa and tissue. Okay, have you open your mouth wide for me? All right, and I'm just feeling the buccal tissue here, the sulcus and gingiva, floor of the mouth, okay, and the other side. Good, and everything feels healthy and normal.
Okay.
Okay, now we're going to move on to the neck. I'm just going to do a general inspection for any fullness, dysymmetry, lesions on the skin, okay? And now we'll look at your range of motion. Have you looked down towards the floor, up towards the ceiling, to one side, and to the other side? Good. And now put your ear to your shoulder and the other way. Good. And now you're just going to look towards my hand. Look towards my hand. Good. Looking at range of motion against resistance. Excellent. And shrug your shoulders for cranial nerve 11. Very good. Now I'm going to palpate your lymph nodes, starting with the occipital nodes, moving to the postauricular, preauricular, tonsillar, submandibular, submental, okay? And then the anterior cervical superficial and deep. On the other side, superficial and deep, and posterior cervical superficial and deep. Good. And then your supraclavicular nodes. Good. Everything appears healthy and normal. Next, I'm going to palpate the carotid arteries and auscultate for any bruits. Okay. So first I palpate the artery and then have you hold your breath. Good, and let it out. Palpate the artery and hold your breath. And let it out. Good. No bruits are heard. Okay. I'm just going to check your tracheal positioning and mobility. Good. And then come around to the side. You're going to feel my hands on your throat here. And I'm just going to feel for your thyroid and have you swallow. And again. Good. Okay, everything feels normal. Okay? And I'm going to bring your gown up so we can get a good view of your arms, so we can look at the upper extremity here. Okay? You can just relax your shoulders. First, I'm just going to inspect the skin for any signs of lesions, discoloration, and look at the color and texture. And then go ahead and palpate the landmarks, starting with the clavicle to the acromion clavicular joint, coracoid process, and the bicipital groove. And we'll do the same on the other side. Okay, and then triceps and biceps. And then look at the epitrochlear nodes and brachial pulse, lateral and medial epicondyles and the olecranon process, and down to the radial and ulnar styloids. Do a general inspection of the carpal bones, MCP joints, PIP joints and DIP joints. Okay, and the same on the other side. Olecranon process. Styloids, carpals, MCP joints, and PIP and DIP. Okay, everything appears to be healthy and normal. So now we're going to take a look at the range of motion of your upper extremity. Okay. So with your hands down in front here, have you bring them all the way up above your head and all the way back and behind you. Good. And now with your palms to your side, bring them up all the way above your head for abduction and all the way back down and cross in front for adduction. Good. And now for external rotation, just have you bring your hands up behind your head, and internal rotation back behind your back. Good. Okay. And now range of motion against resistance. Bring your hands out to the side. Don't let me push them down. Okay. And don't let me pull them up. Good. Very good. Okay. Now bring your fists to your shoulders and back down again, looking at range of motion of the elbow, and up to your shoulders again. Don't let me pull them away from your shoulder. Good, and don't let me push them towards your shoulder. Excellent, good. Now with your elbows at your sides, bring your hands out in front like this. Have you bring your wrists up, down. Bring your thumbs in toward radial deviation and away, ulnar deviation, good. And again, bring your wrists up and don't let me push them down, looking at wrist range of motion against resistance, and bring them back down. Don't let me pull them up. Good, okay. Now spread your fingers as far apart as you can and don't let me bring them together. Excellent. And now, finally, just have you make a fist and grab my finger, squeeze as hard as you can. Excellent. Good. And that completes the examination of the upper extremity. Okay. Mrs. Chua, now we're going to move on to the pulmonary exam. Okay? For videotaping purposes, I'm going to have you move to the side here. Just swing your legs around this direction. Great. So that we can get a picture of the back. Okay? And I'm just going to open your gown in the back. Now, first we're just going to do a general inspection of the skin, looking for any lesions, noting respirations, AP dimension, and also lung expansion. Have you breathe in and out, and again, in and out. Good. Okay. Next I'm going to palpate for any tenderness along the spinous processes. Okay. And along the ribs. Okay. Next, we'll percuss the lung fields. Posterior and lateral. Okay, and then percuss the spinous processes and the CVAs. Okay? Next, I'm going to auscultate the lung fields. When you feel my stethoscope on your back, just take a nice breath in and out through your mouth, okay? Good. Okay, now we'll look at the anterior chest. I'm just going to have you drop your gown just a little bit there so we can see the anterior chest. Great. And again, I'm looking at the skin for any lesions, any signs of retractions, and also noting the AP diameter when you're breathing in. Then I'm going to palpate for any tenderness along the clavicles, sternum, and anterior ribs. Okay? And then I'm just going to have you pull your gown up just to underneath your breasts. Right, so I can palpate your lower ribs. Good. No tenderness there. All right. We'll go ahead and percuss the lung fields. Again, pull your gown up for me. Great. And good. And now I'm going to auscultate the lung fields. Again, just take a nice breath in and out when you feel my stethoscope. Just have you pull your gown up. Good. Excellent. Okay. While we have you in this position, we'll go ahead and check your heart. Okay. First, I'm just going to inspect the precordium. Have you bring your gown up just under your breasts. Good. And then palpate the PMI. Good. Now I'm going to go ahead and listen to your heart sounds. First, locating the angle of Louis. And then listening to the aortic, pulmonic, second pulmonic. Go ahead and lift your gown there. Tricuspid and mitral. And then we'll listen to the heart sounds using the bell.
Okay.
Again, the aortic, pulmonic, second pulmonic, tricuspid, and mitral. Excellent. Okay. Now we're going to do the same thing, but this time having you lay down, okay? So I'll go ahead and bring out the feet here and have you lay back. Okay, are you comfortable there?
Yeah.
Okay. Now in supine, I'll go ahead and check the precordium. Have you lift your gown just to there, good. And palpate the PMI and along the costosternal border and the base. Feel no lifts, heaves, or thrills. And now we'll auscultate the heart sounds, this position, using the diaphragm first, and then the bell. The aortic, pulmonic, second pulmonic, tricuspid, and mitral. Very good. Everything sounds normal and healthy. Okay, Mrs. Chua, now we're going to move on to the abdominal exam. Okay, so I'm just going to have you raise your gown to just below your breasts. I'm going to lower this a little bit more so I can get a good inspection of your abdomen. Just have you bend your knees up so we can relax your abdominal muscles. Good. And again, I'm inspecting for any obvious masses or hernias or pulsations.
Okay.
Have you bring your head up, again checking for hernias, and relax. Good. Okay, now I'm going to auscultate the abdomen, and we'll auscultate at a minimum at 4 quadrants. Okay, and you have positive bowel sounds in all 4 quadrants. Now I'm going to go ahead and auscultate the aorta using the bell, and there are no bruits. Okay, next I'm going to percuss the abdominal quadrants and percuss for the size of the liver. And it should be between about 6 and 12 centimeters, okay? Now we'll go ahead and palpate the abdomen, first lightly. Just tell me if you feel any discomfort.
Okay.
And then a little more deeply. Okay. And now I'm going to palpate your liver. Go ahead and breathe in for me. And out. Good. And palpate the spleen. Go ahead and breathe in. And out. Good. And palpate for the kidneys. And for the kidneys. Okay, and then I'm going to palpate the size of the aorta. And that is very normal. Okay, finally I'm going to check your inguinal region, all right? Just have you straighten your legs out. And here, I'm just going to have you hold your underwear to the side. Good. And here I'm checking and palpating for any femoral hernias, also for femoral pulses, and inguinal nodes, okay? And then finally, auscultate for femoral bruits. Okay, and we'll do the same on the other side. And I'll just start by auscultating here. Okay, and again, I'm checking for femoral pulses, femoral hernias, and inguinal nodes. Okay? Very good. Let's go ahead and begin the lower extremity exam. Okay? For this part, we won't need the drape, so I'm just going to pull your gown down, and we'll get rid of the drape. Okay? And I'm going to inspect the skin for any lesions, discolorations, also looking at the texture and temperature. Okay? And then we'll just pull your gown up to here. How's that?
Okay.
And we'll go ahead and palpate the hip joint and thighs, knee, patella, and popliteal fossa, checking for pulses and cysts. Okay. And calves, Achilles tendon, calcaneus, lateral and medial malleoli. Okay. And we'll check posterior tibial pulse. And dorsalis pedis. Good. Do a general inspection of the metatarsals and toes and capillary refill. Good. Okay. Now let's look at the range of motion of your legs. Just have you lift your leg off the table all the way up and back down. Good. And now I'm going to move your leg for you, okay? Move it in abduction and adduction, okay? And flexion, extension. Do external rotation and internal rotation. And Patrick's. That looks very good. Go ahead and do the same on the other side. Again, flexion, extension, abduction, adduction. Okay, go ahead and bend your knee. All right, do external rotation, internal rotation, and Patrick's. Good. Good. Okay. Now I'm going to have you sit up, okay? So now I'm going to go ahead and test the strength against resistance of your lower extremity, okay? Go ahead and try to lift your leg off the table and push it down towards the table. Good. And off the table and press down towards the table. Good. Go ahead and try and extend your leg and pull it back towards you. And extend your leg, pull it back towards you. Good. Now looking at the range of motion of your feet, can you bring your toes up and back down? Okay, and bring the soles of your feet together and away. Good. Can you lift your big toe up? And how about all of your toes up and back down? Good. Okay, and now just relax your foot. This time try and raise your toes up towards you. And now push them down towards the ground. Looking at dorsiflexion and plantar flexion against resistance. Good. Okay, I'm going to have you step off the table here so we can look at your back. All right, I'm going to come around to this other side. All right, and I'm just going to inspect the back, looking at the skin again, and looking for the symmetry of the iliac crest. I'll have you lean forward. Go ahead and look at the curvature of the spine for any lordosis, kyphosis, or scoliosis. You can stand up. Okay, now I'm going to keep my hands on your hips. I'm just going to look at your range of motion a little bit. Can you lean backwards from your hips? Good. Okay, and now to one side and to the other side. Good. Now keeping your hips facing forward, just twist so you're looking behind you. Right, and the other side. Good, excellent. Go ahead and walk to the sink, observing her gait pattern and balance. Okay, and actually I'm going to have you come back to the sink, and on your way back I just want you to put one heel right in front of the toe like this. Okay. Again, observing her balance and gait pattern. Good. That's fine. You can stop there. Just go ahead and stand with your feet together. Okay? I'm going to have you close your eyes. I want you to just try and maintain your balance. This is testing the Romberg. Okay, very good. Go ahead this time, and you're going to bring your hands all the way up above your shoulders, right? And again, close your eyes. And we'd have her hold this for 30 seconds, looking for any pronator drift. Okay, that's excellent. You can come back on the table now. Have a seat. Okay, now I'm going to be asking you some questions. They may seem kind of silly, but they help me assess your memory and cognition. Okay? Can you tell me your full name?
Jeanette Chua.
Great. And what's the month, day of the week, right today?
December, and today is Wednesday.
Okay, and where are you right now?
Midwestern University.
Great, okay. I'm going to give you 3 objects that I want you to try to remember because I'm going to ask you for them in a few minutes. Okay? They are a rose, a sweater, and a hamburger. Go ahead and repeat them back.
Rose, sweater, hamburger.
Excellent. Now, tell me, who's the President of the United States?
George Bush.
Okay, and who discovered America?
Christopher Columbus.
And who was Helen Keller?
She was the blind lady that somebody helped her learn Braille.
Good, very good. And what were those three objects that I asked you to remember a few moments ago?
Rose, sweater, and hamburger.
Good, okay. Now I'm going to have you do some kind of mental calculations. You're going to start with 100 and subtract 7, and then you'll subtract 7 from that.
Okay.
And you'll keep going until I tell you to stop.
Okay.
Okay? So 100 minus 7,
Okay, 93, 86, 79, 72, 65.
excellent, you can stop there.
Okay.
Okay, next, I'm going to hold my finger up, and with your finger, you're going to touch your nose and then my finger.
Okay.
All right? So go ahead and do that, and you'll keep doing that until I tell you to stop. Okay, how about with the other hand now? Very good. Okay. Next, you're going to take your heel and place it right on top of your shin here. And maintaining contact with your shin, you're going to slide it all the way down and then back up. Okay?
Okay.
Go ahead and do that. And how about with the other leg? Good. Okay. Now I'm going to be assessing your sensation, a little bit more detail here. We're going to use sharp and dull, okay? So I'm going to do it on your hands and your feet. So this is sharp, and this is dull. Okay, you feel the difference?
Yes.
Okay, go ahead and close your eyes and tell me if you feel sharp or dull. Okay?
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull.
Okay, very good. Okay, now I'm going to go ahead and test your reflexes, all right? Just place your hands, just try to relax them if you can, okay? And we'll do bicep and tricep, brachioradialis, okay, the other side, bicep, tricep, brachioradialis. Good. Now we'll do the patellar leg. Good. And Achilles. And finally, Babinski's. Good, and they're negative. That completes the neurological exam.